The government is now considering the erection of field hospitals to support facilities in the western region. Shamela Pullen has our story.
Black River, Savlamar, Cornwall Regional and Noel Holmes hospitals, all damaged by Hurricane Melissa on Tuesday. Health Minister Dr. Christopher Tufton has been visiting the affected areas to assess the destruction. Some patients have had to be airlifted for treatment.
We had to airlift with the help of the JDF and the Honorable Prime Minister's coordination. 3 babies and 2 adults to the University Hospital, which took place yesterday, including 1 doctor who was injured during the storm. You would have seen the reports on Black River and St. Elizabeth generally. It's really bad. So the attempts are now being made to clear the roads from Mandeville to Black River to relocate about 71 patients that we have. The patients are fine, the staff are there, but the hospital is badly damaged, seawall gone. It's in a really bad state.
Cornwall Regional Hospital in St. James, a Taipei health facility, has also suffered significant damage, though the renovation areas were spared. The hospital has lost around 100 bed spaces, displacing many patients.
The A&E roof was lifted, had to be relocated into the diagnostic center next door. Very cramped space, so it's very difficult. But there is generator capacity, so electricity and water, which is good. So they're now trying to restore the A&E, which is the Mount Salem Clinic, expanded to try and get patients back into that larger space. But as of now, they're in the diagnostic center next door, and the space is very limited.
Noel Holmes Hospital and Health Center has also endured extensive damage. Authorities are working with the government and the Jamaica Defense Force to provide support for the affected hospitals.
As I see it now, we're likely to require maybe a field hospital or 2 in a few of the areas, Black River, maybe Noel Holmes, and maybe even Cornwall. I'll see what happens at Sav. Some coordination is taking place to support those efforts, but also to quickly assess and to bring back the areas that we can bring up quickly so that we can continue to provide emergency and patient care.
Shamela Pullen, TVJ News.